Risks to embryo or fetus. Hypertension. This is abnormally high blood pressure. This can be a risk to the fetus. This can restrict the growth of the fetus. Gestational diabetes. This is high blood sugar during pregnancy. Early labor can be a complication. Respiratory distress, that's breathing problems. Macrosomia, okay, this is an excessive birth weight. This is 9 pounds or more. This can cause the baby to get stuck in the birth canal. Okay, trauma, this causes trauma during delivery and may require a C-section. That's when the stomach is cut open and the baby is pulled out. STI'S, or sexually transmitted infections, can be a risk. So fetal syphilis can cause death or birth defects or disabilities. HIV, 30% chance of transmission to the fetus during pregnancy if mother has it, and 25% chance of transmission to the fetus during delivery if mother has it. Gonorrhea and chlamydia, okay, can cause early delivery or rupture the membrane of the amniotic sac. Age, so teenagers, so anyone less than 20 years old, the risks can be preeclampsia. Okay, so this is high blood pressure and retention of fluids. Okay, this can cause early delivery, anemia, which is low iron. These can lead to early delivery, okay, and restriction of growth to the fetus. If someone is older than 35, now it's important to say this with a little caveat. Okay, so if a person is older than 35 and they have any of these age-related issues, it can be a problem, right? If they're very healthy, you might not have that problem. But okay, so if someone's older than 35, increased risk of preeclampsia, okay, gestational diabetes, dysfunctional labor, abruptio placentae, which is when the placenta detaches from the uterine wall, stillbirth, and placenta previa, which is when the placenta blocks the exit to the uterus. Also can be a risk of chromosomal abnormalities, less or more chromosomes. And the example I gave is of Down syndrome. Weight can be a risk. If a person's underweight, they may have a baby with a low birth weight. If they are overweight, they might have high blood pressure, gestational diabetes. This may delay labor. Okay, the baby may be overweight. Fetal growth may be restricted as well. Okay, and birth defects and a C-section may be the only way to deliver the baby. As far as nutrition is concerned, during pregnancy, folic acid is very important. It's good to have high amounts of folic acid before a person gets pregnant. Very important to the formation of the brain and spinal cord. Okay, low folic acid can lead to neural tube defects such as spina bifida, incomplete closing of the backbone, and membranes around the spinal cord. Okay. And anencephaly, which is missing parts of the brain and skull. Calcium, okay, so it's important for bone, teeth, circulatory system, and muscle development. Protein is very important, okay, for fetal growth. Iron, needed to make the extra blood your body will need, as well as the blood supply for the baby. And low iron is called anemia, okay, and can lead to fatigue, being more susceptible to infections and early delivery. Smoking can be a risk. Okay, reduces the supply of oxygen to the fetus. Nicotine and carbon dioxide increase, right? Early delivery may be a result, and low birth weight. Fetal alcohol spectrum disorder, okay, is caused by the consuming of alcohol during pregnancy and can lead, okay, to many symptoms. The reason I put can lead is because it is a spectrum disorder, meaning that just because a person has fetal alcohol spectrum disorder doesn't mean they have every single one of these. Okay, people lead very different lives based on ability and complications that arise from fetal alcohol spectrum disorder. But some of the symptoms may be low birth weight, below average height and weight, smaller head circumference is an indicator, developmental delay can be, organ dysfunction of the kidney, the heart. Okay, so we can have heart problems, kidney problems, problems with seeing and hearing, as well as sometimes people have facial abnormalities. Okay, there's FASD with facial features and FASD without facial features. If the person has the facial features, they include things like smaller eye openings, flattened cheekbones, and indistinct philtrum. Okay, that's the underdeveloped groove. That's an underdeveloped groove between the nose and the upper lip. This is a picture of what that might look like. Shorter nose, that philtrum that normally is in between here is a little bit more underdeveloped. Okay, it's more indistinct, thinner upper lip. Okay, flat mid-face, and this part of the eyes may be shortened. Okay. People may also have epilepsy that have FASD, poor coordination and fine motor skills, poor socialization skills, such as difficulty building and maintaining friendships and relating to groups, lack of imagination or curiosity, lower IQ, learning difficulties including poor memory and inability to understand concepts such as time and money, poor language comprehension, poor problem-solving skills, behavioral problems such as hyperactivity, inability to concentrate, social withdrawal, stubbornness, impulsiveness, and anxiety. Okay, so I'm going to again say, just because a person has FASD doesn't mean they have all of these things, okay? But they may have some of them. Cerebral palsy, okay, this is also comes as a result of a risk in pregnancy. This is abnormal development of the parts of the brain that control movement and can be caused by inherited genes, toxins, or infections during pregnancy, trauma to the developing fetus, or trauma during delivery, and can lead to poor coordination, weak, stiff muscles, or tremors, difficulty with sensation, vision, hearing, swallowing, and speaking. And again, it affects all people very differently with cerebral palsy.